Hello, my name is James, and I'll be acting as the RN.
My name is John, and I will be acting as the patient who will also be named John in this script.
Good afternoon, John. Well, my name is James, and I'll be your nurse today. So, before we begin, can you confirm your name and date of birth?
Yeah, my name is Jon Bachman, and my date of birth is May 22nd, 1991.
Excellent. All right, so today I'm going to be talking about your discharge plan. So, I'll kind of be going over what to expect when you return home, the medications that you should, continue to take, the diet, the activity, and some of the warning signs to look out for. So, please feel free to ask questions anytime.
Thank you. I'm a little nervous about going home, but I'm ready to feel better.
Okay, excellent. So, we want you to be an active partner in your care plan. So, who will be helping you at home?
It'll be mostly myself, but my son Eddie will come and be there 3 times a week to check in.
Excellent. So, we'll make sure both of you understand your medications completely and what to watch out for so you can go home and stay comfortable there.
Sounds good.
Excellent. So when you go home, your body is still going to be adjusting from this hospital stay. It's very important to rest, but it's also important to, move a little bit and not be stationary throughout the day. So walking to the kitchen or the mailbox is a good start.
Sounds good. I used to walk my dog every morning. Can I still do that?
That is great. Exercise, but for now, just keep your walks short. So, just down the driveway and back. And you should stop if you feel short of breath or tired because your heart really needs to build up that strength slowly.
All right, I guess I can do that.
Okay. So you'll also want to sleep in a reclined position or propped up on pillows to help you with that breathing. So go ahead and try to avoid stairs and, keep frequently used items like your medication and water and stuff within your reach that you can grab easily. So you'll also be following a low sodium diet, so no more than 2 grams per day and a 2,000 milliliter fluid restriction. And that includes coffee, soups, and jello. So go ahead, avoid salty foods like canned soups, deli meats, and chips.
Oh, I love soup. Can I still have some of that?
Yes, as long as it's low sodium or homemade without any extra added salt. Herbs and lemon juice can also help with the flavor. So let's review your medication so you know what each one does and when specifically to take it. So the first one is carvedilol, which is 3.25 milligrams. What this does is it slows heart rate and it lowers your blood pressure. So you take it with food. You rinse slowly to prevent any rise. You rise out of bed slowly to prevent any dizziness. The next one is lisinopril. So this is basically to lower your blood pressure and it also protects your hearts and your kidneys. So you go ahead and you can give us a call or let someone else know if you report a dry cough or swelling anywhere. So torsemide, 20 milligrams 2 times a day. So this is called a loop diuretic. What it does is it acts in your body and it gets rid of any excess fluid that is built up. So you want to take it in the morning and you monitor your daily weight. Maybe put it in like a log or something. So warfarin 5 milligrams once per day is next. So this is an anticoagulant, so basically what it does is it prevents your platelets from coming together and blocking off any blood vessels, and it prevents clots from atrial fibrillation. So if you have any bleeding, um, you go ahead and report it to us immediately and avoid sudden vitamin K changes, such as taking too much or not taking enough. So we have next is hydralazine 25 milligrams 4 times a day. So what this is it's a vasodilator, so it reduces the workload on the heart and it makes your blood vessels expand to lower your blood pressure. So it can cause headaches or flushing. So those are just some side effects to look out for. So what we have is also ASA, 81 milligrams daily. So this is an antiplatelet. So kind of similar to the mechanisms above, it prevents clot formation and, it keeps your blood flowing steadily. So the main thing that you want to watch out for with this is you want to take it with food. Now, what we have next is ezetimibe 10 milligrams daily. So what this is it lowers your cholesterol or the levels of fat in your body. So what the biggest thing is that you want to do with this one is report any muscle pain to us. So moving on, we have potassium chloride, 20 milligrams once per day. So this is basically an electrolyte. It helps maintain your potassium levels in your body. So go ahead, and this is really important. You don't want to crush the pill. You want to take it with food too. So, and last we have glyburide, which is 5 milligrams daily. So, this is an it's a hypoglycemic. So, it means it controls your blood sugar. If your blood sugar gets too high, it helps lower that down a little bit. So, you want to eat it with regular meals and monitor the glucose that you're taking.
There's just so many pills. How am I going to keep them all straight?
So, a weekly pill organizer will for sure help, and you can set phone alarms and different reminders to help you. I'll also go ahead and print out your medication list for your refrigerator so it's easy to look at, remember,
Oh, that'd be great. Thank you so much.
of course. It's also very important to recognize, certain early warning signs of worsening heart failure or what you were in here for. So go ahead and call your provider if you notice a weight gain of more than 2 pounds in one day or 5 pounds in one week. So if you feel like your feet, ankles, or abdomen is swelling and there's an excess amount of fluid in there, also shortness of breath, maybe that happens when you're not doing something or you're at rest or you're walking about, fatigue, dizziness, or any other sort of confusion. Um, maybe some you can also experience chest pain or it feels like your heart is beating unevenly or quite loud for your body. And if you experience any bleeding or you just see these random bruises popping up about your body, go ahead and you can give us a call.
What if I feel a little more tired than usual?
Hmm. Well, that's a good question. If your tiredness is mild and it just goes away with rest, that's okay. But if it continues to get worse or comes with shortness of breath or swelling of the limbs or the abdomen, you should go ahead and give us a call right away.
Okay, I
S-
guess that makes sense.
yeah. So I'm just going to be going over some of your test results here. So your brain natriuretic peptide which is which was 1,855. So basically, what BNP tells us is it is released when your heart is under stress and is holding onto your fluid. So your creatinine was 2.9, and that is released by your kidneys. It basically means that your kidneys are working significantly harder than they should be. The good news is that your other labs are stable. So by taking your medication and, following the fluid limits and the diet regimen, we expect that these numbers will improve.
Will my heart ever get stronger?
Well, it may not return to normal, but with consistent care, we can prevent it from worsening and help you live more comfortably.
That makes sense. I just want to be able to breathe easier again.
Okay. Yeah, I understand. Well, so it looks like you have a cardiology appointment in 1 week and a primary care visit in 2 weeks. So you can go ahead and have your labs drawn the day before the cardiology appointment and bring your medication list to both visits.
Should I be checking my weight at home?
Yes, absolutely. Every morning after you use the bathroom, before eating or drinking, go ahead, you can write it down in a log and bring that to your appointments too.
Okay.
Mm. So, basically, the condition that you are experiencing is called systolic heart failure, which means your heart doesn't pump as strongly as it should. So, by limiting sodium and fluids, taking medications, and monitoring your weight, you can reduce that strain on your heart.
I'll try to follow everything exactly. I really don't want to come back here.
Well, that's the goal. We'll make sure that you have everything you need to succeed at home. So, can you go ahead and tell me the main reasons that you should call your doctor?
If I gain weight quickly, get more shorter breath, or if my legs swell up,
Perfect. And how much fluid are you allowed per day?
about 2 liters total.
Excellent. You're doing great, Mr. Bachman. So, do you have any other concerns about managing your care?
I'm just afraid of missing a dose or taking the wrong pill.
That's understandable. Yeah. You can go ahead and ask the pharmacy about blister packs. So what those are is they'll help you separate your medications by the time of day, and that way you won't miss a dose.
Oh, that would be extremely helpful. I'll ask them.
Awesome. So, seems like you're doing pretty well, John. I feel like you've learned a lot about your new condition and how to manage it. So go ahead and remember to call your provider if you feel worse or you have any symptoms, and you don't need to wait.
Thank you for taking the time to explain everything to me. I feel a lot more confident now.
You're welcome. Very proud of you, John. Take care, and we'll see you next at your next follow-up.
Sounds good. Thank you.